a primarily physical therapist. I've been doing both traditional land-based physical therapy and have been doing now aquatic therapy for a couple years now. And so I want to kind of introduce and give you the benefits of what aquatic therapy is all about. It's kind of an alternative to treatment. So, first slide. So what are the benefits of aquatic physical therapy? Well, there's many benefits of aquatic physical therapy. One is to reduce stress to the joints, to promote range of motion and flexibility, to improve muscle strength and muscle tone. It aids in pain control and edema reduction. It helps to improve posture and balance, which again, Dr. Heiner talked quite frequently about. So it all helps promote relaxation, circulatory, respiratory, metabolic, and cardiac and kidney benefits. Next slide. So what makes aquatic physical therapy so special? Well, aquatic physical therapy is a program that utilizes the special qualities of water. The first one being buoyancy. So buoyancy is the upward force exerted by fluid when the body is immersed. When the water becomes displaced, you are more unweighted. When you are more unweighted, it's going to make it easier to decrease stress to the joint and take pressure off the injured area. What's really nice about buoyancy, it's very effective for those who either have had a chronic injury or have had slightly paralysis. It makes it a much easier environment to work on. The next is relative density. Relative density basically means, are you going to float or sink? So leaner muscle mass is a little bit more dense and more tendency to kind of sink. When we have an injured area, one that is more swollen, more edemic, adipose tissue, it's going to float. So the beauty of the water, because you're going to float a little bit easier, it's going to make it an easier environment to work in. Fluid resistance. Fluid resistance is a force that opposes the motion of an object when you're going through the tissue. So what makes this a little bit easier? Well, when we have an aquatic surface such as a resistance pool, you can go with the resistance to ease off some of the tension and make it a little bit easier to work, or you can go against the resistance. Other options that help with fluid resistance are weighted dumbbells or float paddles or noodles. Those are the things that we can kind of work with to alter and change the fluid resistance. The last quality of water is turbulence. And turbulence is basically like the swirling motion of the water around the body. Things that make turbulence, it would be, let's say we were in, remember like the old days when we were in like a kiddie pool and everyone kind of went around in a circle and a circle and a circle, and then you tried to stop. Well, that turbulence keeps things moving, and it's also going to affect your balance. What's nice about the turbulence of the water is that it changes things front and back, so it's always going to be challenging your balance system. So in regards to balance control, people think, oh, well, the water makes it easier, but in some ways it can also make it more difficult depending on kind of what depth of water you're working in. When we're working in a little bit more shallow water, it's going to be a little bit more difficult to maintain your balance because, again, you have the effects of a little bit more gravity. When we're a little bit more immersed, such as in deep water exercise, you'll be able to decrease some of the effects of that turbulence and decrease some of the effects of that gravitational pull. Thank you. All right, next slide. So who can benefit? Well, I've had many different patients and many different clients. I've had kids in from, 6 to all the way up to 80 or 90 years old. So neurological conditions such as autonomic disorders, fibromyalgia, chronic pain, multiple sclerosis, Parkinson's disease, and other neurological conditions can all benefit. Things that we are more generic are post-operative patients, seniors with weakness or balance issues, pregnant women, hip and pelvic pain, overweight, arthritis. So basically anyone that's having difficulty tolerating a land-based program. So who should avoid aquatic therapy? Well, those with any recent surgeries, open wounds, active stitches, UTIs, incontinence. And when I say incontinence, that's those that can't control it. Again, it's not an indication if someone's having problems during that time frame. But again, if you're regulated through your medications and you're able to control your urge and bowel bladder incontinence, you can come into the pool. Active seizure disorders. So again, those unrelated by medications. Viruses, cold, flus, anything contagious. Allergies to chlorine. Doesn't happen very often, but yes, it can happen to people who get into the pool, start developing rashes because they have chlorine or pool sensitivities. Fear of water. I've had many clients always tell you their horror stories of how they were pushed in as a child and then aren't able to participate because they have some fear of being in the water. But we've had a lot of people who still are fearful of the water, and because of such a great freedom of movement, can come back in and try to work on progression of strength and balance. So what do we need for aquatic physical therapy? Well, we need a pool, of course, and I see you've got some beautiful pools outside here. Swimsuit, of course, that's required. No birthday suits allowed. Water shoes. Water shoes are optional, but for those who have balance issues, and many folks have other conditions, diabetic foot issues, shoes are recommended just because the pool tends to be a little bit slippery, the surfaces a little bit more uneven, and just to keep better safety. So what are some of the items that might be used in the physical therapy course? Well, we have the flotation noodles, which I talked about. Flotation noodles can be used as a source of assistance. So we have people that can be floated in the water. You can be immersed partial. You can be immersed total, where you're totally laying back and you have passive movement allowed to increase the range of motion and increase some of the movement patterns. Partial, depending on kind of your relationship of where you are with your blood pressure, because the aquatic and the pool tends to lower your heart rates, which is beneficial, but it also can affect your blood pressure. So those with medications that may cause some of the blood pressure changes, we want to make sure that we're not totally immersing you right away till we know that someone's stabilized. Float paddles, water gloves, kickboards, water dumbbells. Those are all things that we use for resistance. Water gloves kind of are gloves that go on the hands that you can kind of put on, and it's almost like feeling like you're a duck. You can have the resistance of the water, and it allows for a lot of freer movement patterns. What is nice about both the dumbbells and the gloves, it allows for more natural training of arm swing and coordinated gait activities. So, all right, so what are the things that we look at in regards to physical therapy and things that we're going to work on correct? One of the first ones is posture corrections. So, as everyone has been saying, there's a lot of postural deviations. Parkinson's patients tend to be a little bit more slumped, rounded, a little bit more rigid. So we need to work on first correcting some of those deficits in regards to lack of range of motion, improving some of their joint flexibility. The water is wonderful for doing that because, again, you can use the float aids to assist a muscle group that's been weakened or doesn't have the quite appropriate movement patterns. You can use, where we're at, we have two people, we can float somebody and we can really unweight them to help promote the motion and get them back into their kind of targeted posture position, retraining the muscle groups to direct and give them a sense of where their base of support is. Because when we get into faulty postures and depleted positions, we tend to change our center of balance. When our weight has been forward for so long and we're so used to kind of staying down or looking down, we change our balance system. We change our awareness, our body kinesthetic awareness of where we are in space. So our goal is to help kind of redirect that and provide movement patterns that are safe and effective to help you get back to where you are for walking. The other things that we're going to look about is core education, so strengthening. Strengthening is going to be designed to help promote muscle tone and muscle balance. Without appropriate strength, it is hard to maintain an upright standing position. So again, regards to where someone is, we're going to have to kind of grade their exercise program. In the aquatic environment, you can start in sitting in the water, to make things a little more easy. So you have to direct the strength program, the exercise program, to where somebody is coming in and what level of functioning they're at. Endurance is a big issue. So in water, and I know Dr. Schmitz talked about water jogging, we're not going to start somebody off water jogging if they can't barely get off the wheelchair or they're using a walker for assisted device. You have to start at the basics and kind of work your way up. And that's what's wonderful about the water, is that it allows you to grade that exercise program to start at a lower level, get them up, give them some freedom of movement to where they might not have to use that walker for a little bit. They can kind of have some aids around into the pool to slowly build up and give them positive reinforcement to help kind of reduce some of their strength and improve some of their strength. So is aquatic therapy covered? Well, for most insurances, it has been covered. So Medicare and Medicaid are insurance providers that do take aquatic therapy. If a therapy clinic does not have an aquatic therapy program, sometimes cash pay as option by most therapy clinics. And then to look up for how to find an aquatic therapy program, again, a doctor referral is needed to establish an aquatic therapy program. And using keywords such as aquatic physical therapy and the name of the city of where you live can help kind of determine if aquatic program is near you. So just want to kind of go over, and again, you can just kind of look at those and read those on your little handouts. But again, I just want to kind of read a little bit of a quote from someone who started in aquatic therapy. It has been able to increase my strength and give me the ability to work without feeling ill. It has really helped my health as well as my emotional happiness. I am thankful for the time and energy that aquatic therapy has provided for me. So again, it gives people an alternative. Land-based therapy, as people say, oh, it's just so much work. I want to be able to exercise. I want to be able to get back to the things that I need to do. I want to play with my grandkids. I want to be able to play with my dog. I want to just get out and get up without feeling sick. It has been a wonderful experience for me to kind of get involved into an aquatic therapy program, because it's just opened my view of how I treat and how I look at patients, and it just has been so beneficial for people to kind of get into an environment that gives them the ability to take small steps into getting back into better health. So I appreciate the time and energy, and I hope that everybody enjoys their time here. Thank you.